Breast implant illness is everywhere and unavoidable. I'll have to say, is one of those things that we see very often in our practice, and it is real. I feel bad for the patients who ultimately ended up getting some version of this. But the good thing is we can take care of it. It is treatable. Having surgery to remove your capsule and to remove the implant, a lot of patients get better. Unfortunately, not everybody does. A lot of patients have other underlying issues that can be happening at the same time to give them the symptomatology that they have. Studies that we have in our society and what we can tell you internally here, if you do have BII and you remove the implant and you remove the capsule, a vast majority of patients do improve and their symptomatology does improve. There's no diagnostic test for these individuals. Unfortunately, surgery serves as that diagnostic test. I would tend to tell you to go down the road of looking and analyzing and making sure there are no other things that are happening before you go down the road of wanting to remove your implants. But without a doubt, if you're worried about it or you think you have symptomatology associated with your implants, go see a board certified plastic surgeon and discuss these concerns with them and what your options are. Liposuction is a weight loss procedure. It is definitely not a weight loss procedure. Liposuction is great for contouring and for individuals who want removal of fat in certain areas. You definitely don't want to do it for weight loss. This is more of a body contour specific procedure. You want to do the interventions necessary for weight loss if you want weight loss. There are GLP-1s now, or there's the traditional way of diet and exercise. And I tend to tell everybody, lead the right lifestyle. Make sure you take care of yourself. You take care of your body. You have one life to live. Make sure that you take care of your body to give you the results that you want long term. But yeah, do not use liposuction for that weight loss. Do other methodologies, but make sure you live a proper lifestyle as part of the deal. And if you want lipo, get it for the right reasons. Cosmetic surgery is the same as medical spa treatments. Not true. Here's the thing. Cosmetic surgery is real surgery. A lot of times people come in, they assume they want a surgical intervention. They can go back doing their normal stuff that weekend or the next day. Now, there are some interventions that we can do that you can give you that fast recovery, but it's real deal surgery. It's not like a med spa treatment. You can't have it done and do normal stuff the next day. We do help enhance whatever you're looking for, be it your nose, your eyes, your breasts, your body. We can tailor that and give you the ideal outcome that you're looking for, but it's real deal surgery, and make sure that you're prepared for that real deal surgery. Tummy tucks are just for moms. Tummy tucks are not just for moms. I've done tummy tucks on individuals who've always had excessive belly. They've always had excessive skin in that area or excessive fat and they want to get rid of it. We do tummy tucks on men all the time. So it's not just for individuals who are post-pregnancy and post-babies. So it can be for everybody. The key here is to really analyze what you're trying to achieve. If you have loose skin, you might need a tummy tuck to remove loose skin. If your muscles are not together, you may need a tummy tuck to actually bring your muscles together and give you that kind of flat contour. Or if you always had excessive skin, you ultimately may need a tummy tuck just for skin removal. Not all tummy tucks are created equally, and it's not just for moms. It can be for everyone. Board certification doesn't matter. False. Board certification really does matter. Make sure that your surgeon is board certified in the specialty that you're looking at. Make sure they do a lot of the procedures that you're looking for. If you're going in for breast augmentation, make sure that individual does hundreds a year, if not thousands over their career. Same goes for facelifts or tummy tucks. You want to make sure that that individual that you're going to see is credentialed appropriately to be able to do the procedure that you're wanting. You should be able to jump back into normal life immediately after surgery. It's cosmetic, not medical. And I think we brought this up before. Cosmetic surgery is actually real surgery and it has real recovery. You're not going to just get back to doing your normal activity right away. However, there are certain interventions that we can do that limit your downtime, but most of these surgical interventions do require downtime, and it's okay. You're getting surgery done, you're getting a surgical intervention. It does require downtime, but when it's all said and done and you get the results you're looking for, you're going to be extremely happy with that. But make sure you understand what that recovery process looks like. You can fix facial asymmetry completely with surgery. We're all born with asymmetries. It's very difficult to find anybody who is perfectly symmetrical. With surgical intervention or cosmetic procedures, you can actually limit those asymmetries or slightly correct those. Never will we ever correct them 100%. We're not going to make a perfect symmetrical result. We're not going to give you perfect symmetry of the face. We're not going to give you perfect symmetry of the breast or of the body. Our goal is to help enhance it and to limit the asymmetries. One of my analogies is everybody is born or has this level of asymmetry. And what we ultimately try to do is get you as close to each other as possible, knowing that we can never achieve that ultimate perfection. Facial surgery stops the aging process. That is false. When we do facial rejuvenation procedure, we actually turn back the clock. Unfortunately, the clock continues to tick. And because of that, the aging process continues. So by doing any of our interventions from eyes to fat grafting to facelifting, what we ultimately do is we turn back that clock. And we can turn back the clock multiple years to 10 to 15 years. But that clock will still keep ticking, and you'll still need to have interventions along the way to slow down that aging process.